Yeah, you just described probably at least a quarter of Loudoun County with regards to a lot of the parents. And you see oftentimes the parents coaching the kids on the field, and the coaches are always sending messages. You're giving them the wrong information. We're trying to work them doing something else.
Right.
That's got to be something huge when you're dealing with a junior athlete, where there probably is like, hey, my dad or my mom is being too overbearing, not overbearing, but just on me, and that making them play tight. There are some kids I know that, like, I prefer my parents not at my games at all because I just can't perform in front of them.
Mm-hmm.
How is that? How are you dealing with that scenario?
Mm-hmm. Well, the truth is there are some things that are outside, what they call it, outside of your locus of control. So if you're the athlete, there there's certain things you just can't control. It could be what parents are saying in the stands, or who's attending the game, or if there's scouts there, or people who are looking to maybe might be recruiting you. That you don't know who, you can't control who's evaluating you, or who's watching. And so we do a lot of attentional focus training, precisely so that you can thrive in those situations. Because you're right, if you don't do that well, there can be real attention lapses, there can be a lack of focus. It can lead to a lack, then it can impact execution, performance, and results. So a big part of sports psychology is working with the athlete and saying, listen, it's kind of inevitable that there are going to be some distractions and some things outside of your locus of control. But then you have to know what to say to yourself. That's called your internal dialogue. What do I say to myself in those situations? And how can I shift and redirect my focus onto a more preferred target, rather than looking at the person in the bleachers, or thinking about what coach has just said to you from the sidelines? How do I redirect so that I can continue to perform at a high level, so that these distractions doesn't impact me and my play? And that's not the easiest thing to do sometimes. And so while I like to work with coaches and parents and talk to scouts and everything, you can't control certain things. So just like mistakes are inevitable, it is inevitable that there are going to be some things in competition that are outside of your control. And those are the type of things that can affect focus and performance. But it's another reason why you have someone like someone in mental conditioning as a part of the performance team. Because what you'll find, Andrew, this whole field has become very specific, and people kind of in their own performance lanes. So I can't do what coach does, and I can't do what you do. I'm not a certified physical therapist or exercise physiologist. I can't do what you do. I don't know the X's and O's like coach. I can't do what an athletic trainer does, right? But oftentimes, some things that we're talking about, coach is not equipped to deal with it, because he or she doesn't have the background, education, or training, and neither does the person, let's say, who's the physical therapist. The only difference is, oftentimes, if you're an athlete, you might have some background in mental training and sports psychology, or if you're a coach. So by definition, sometimes you'll have strength and conditioning personnel or coaches who will have some level of familiarity with all things related to sports psychology, and I will know a little bit less about what they do. And that's often the dynamic, but it's important to know what you know, and it's important to know what you don't know, and to see performance not narrowly, but more integrated. That not only is there a physical dimension to athletic performance, and not just the X's and O's and having good technique and technical skill, there is this mental and emotional part. But the more competitive the athlete is, the more they recognize how important the mental game is, so that how they're thriving both outside of sport and within sport in competition.
All right. So I've as you've spoken, I've come up with two questions, and one that probably people might be wondering is, is it a myth or is it real? Like getting into the zone. There was a book I read and it was something along the lines of something Superman decoding, what becomes a Superman. And they talk about how athletes are able to get into the zone. I've also read a book by Tim Grover and talking about the different type of basketball players they work with. And he was the strength and conditioning coach for Kobe Bryant and Michael Jordan and Dwayne Wade, talking about, coolers, cleaners, and something else. But do guys come to you to say, hey, what can you do to help me get into that zone where like I said, I read this book and they talk about, I guess, like for instance, they did a study of people doing, and you work with the airborne, where they had 3 groups of people trying to learn a new system, and they had experienced parachutists jump out, and then they gave them this problem to try and solve afterwards. Mm-hmm. Then they had an amateur person who just went out and parachuted for the first time, and then they had a control subject who didn't have any background or in parachuting or anything, and they said the guy who's a regular parachuter was able to pick up this new idea or tactic really quickly. And then the second most was this person that there was some sort of biohack that because they went in there, it wasn't an adrenaline rush, because they talk about the adrenaline comes initially and it flushes your mind, but then there's another step after that where everything slows down and calm, and you can just kind of, you do what you've been trained to do. Is this something that can you get me into the zone in my golf? I mean, I felt it. There's like 5 holes where I can't miss, and all of a sudden it's gone. It's gone.
Okay. So the phrase getting into the zone is sort of a sports psychology term. I think people have heard it before. Majority of the athletes have, and maybe even people who are just sort of those weekend warriors, the people who play, and could be on a sort of an amateur level or just occasionally. So whether you call it the zone, sometimes they call it to be in the groove. Oftentimes they'll call that basketball, or to be in. It's called being in this flow state. You hear the word flow a lot. So whether you call it in the zone, in the flow, in the funk, in the groove, it all kind of means the same thing. So one way to think about the zone is it's like the highest mental state for performance. So when I'm working with athletes, we want more sort of zone performances. We want them essentially to feel the way that they like to feel, which is they are confident and they are trusting, and everything is so simple and it feels great. And they're not thinking about anything. They're not putting any pressure on themselves. They are loose. They are fluid. And when they are like that in both mind and body, and that whole mind-body connection is working for them, we call that getting into the zone. And there's almost a predictive value that when you're in this highest mental state for peak performance, that as long as they're really good, tactically and technically and physically, there's a predictive value, that a statistical predictable value that talent and ability is going to transfer onto, between the lines. But it's a very interesting thing is that you can't try hard to get into the zone. Okay? That's like the trying is the problem. Think of it this way. You can't try really hard to go to sleep, right?
No.
You can, and often with trying is the self-requirement, which is I have to go to sleep. I need to go to sleep. I have to get 7 hours, so I'm, my cognition is good in the morning. So once the internal dialogue, the self-talk becomes very demanding. I have to go to sleep. I need to go to sleep. Then you're going to try really hard. And why are you trying hard to sleep? Because you have to. You need to. You're putting that demand on yourself. And so the same thing is true about the zone. You can't put pressure on yourself and try hard to be in this more preferred mental and physiological state so that you achieve some of your wants in competition and perform at your best. The way that you get into the zone is you apply some tools that a sports psychology type would give to you. This could be some simple meditative work. some mindfulness work, getting a little relaxation response in there, coupled with your breathing in mind and in body. There's certain things you can say to yourself that cultivates that more powerful self-image, things that really drive up confidence in yourself and trust in your elite talent. And it's a combination of these sort of psychophysiological tools that someone like me would give to the athlete to apply. And the just being in the zone just sort of takes care of itself. You kind of just drift right into it. And now when you are in that zone, and you know what that feels like, right, Andrew? It's like, it's so simple and it feels good and you just wish you were there forever, because you see the connection between the mental game and athletic performance, especially on the mental side when you're in this peak, when you're in this zone, and everything is just rhythmic, and you're loose and fluid. Such a good mind-body connection. But here's something to consider. It's consciousness, that self-consciousness that takes you out of the zone. So let's say you're performing at a really high level and you start evaluating how well that you're doing. It's being internal and now self-consciousness and thinking about how well you're doing and evaluating it. You drift right back out of the zone. And so, because when you're in the zone, right, you're not thinking of anything. You're just sort of just reacting, right? And just your training is taking over. Maybe you've had an experience where you are performing really well, you're in the zone, and you're almost saying to yourself, like I don't even know who that is out there. It's like I don't even, it's just sort of unconscious, performance. The opposite of that is when you start deliberating and evaluating and critiquing how well that you are doing. That feel goes away and you get out of the zone just as quickly as you entered it. And so for consistent high level execution performance, through the mental skills training, you're able to be in that flow state, not only more often, but to sustain the duration of it when you're in it. Does that make sense?
Yeah. I mean, it's not like anyone could walk out and get into the zone. You look at like a Steph Curry who's taken hundreds of thousands of shots and he's honed his stroke but he can get into the mental zone where he's blocked everything out and he's super focused and he's just allow himself to just muscle memory go. But there's times where, like you said, there is that mental aspect of being able to block everything out. That's all the noise, all the static, be able to be honed in, focus, and you don't think about it. You just react.
There it is. So it's a lack of active thinking that's associated with being in the zone. So I'll give you the Steph Curry example. Let's say Steph just, when you want the ball, because this confidence is just oozing out of you and you're in this great flow state, just like get out of the way and give me the ball. It's that level of it's that level of self-certainty that you're going to execute at the highest level precisely because you're sort of feeling it. You're in the zone. So let's say Steph Curry is feeling that and knocks down, like 6 threes in a row. Let's say he drops 22 in a quarter. I mean, that's some quarter, but when he's done it, when he's in the funk, he can do it, and more often than most. So let's say he drops 18 or 22 in a quarter, and let's say at half, let's say at the end of the quarter or at halftime, let's say the sports reporter is interviewing Steph, okay, and let's say the reporter says something like this, like, Steph, 22 points in the first quarter, just off the charts. What were you thinking out there? What do you think Steph's answer to that question is?
I wasn't thinking at all.
I wasn't thinking of a damn thing. I wasn't thinking of anything. It was just it was just knowing, having that just highest level mental state, just off the charts confidence in yourself and trust in your training, and then sort of the behavior follows. So this notion of the zone, you don't want to get too caught up in the term or the phrase itself, but every athlete wants to be in the zone, and through mental skill development, mental skills training, it helps us to develop this psychophysiological skill set to have that confidence, that trust, that loose, that fluid. Everything is simple. We're not thinking about anything. We're not telling yourself that you have to or I need to. None of that exists. And this is something that that I certainly do regularly. That's part of the mental performance training. And as I mentioned before, that's not something typically that, let's say, a strength and conditioning coach would do, or a coach who's doing X's and O's, or maybe developing a certain technique in terms of how to keep, let's say, your shooting stroke, how to keep your elbow in, have it roll off your fingertips, follow through. That's more the technical and the mechanical skill development. But that has nothing to do with what we just spoke about, to get that talent to transfer onto the court in the Steph Curry example.
Yeah, I think it's good in sports like baseball and golf, where you don't necessarily have that interview during the game or at the intermission like you do with basketball or with hockey, where like, well, I wasn't thinking about it, but now thanks for, bringing it to my attention. Whereas like you have that pitcher who's throwing the no-no, the pitcher's off by himself. No one's talking to him. No one says anything. No one discusses the no-no. It's just, hey, you're probably aware, the pitcher is aware of it. Have you ever dealt with any of, pitchers that are like, discussed after the fact? Like, what do you think it was to kind of help people get further off? Like, hey, you just pitched a no-no. What information can I garner from the athlete to better help my practice? So does the information flow that way as well?
I just want to make sure I'm really understanding the question. So first of all, pitching and no hitters, it does not happen every day. But can you just sort of ask the question a little bit of a different? Is part of the question that what do I do? Let's say with a pitcher when things do not go well, in terms of a post game and a debrief, to try to connect the dots, like what happened here?
No, I'm talking about like someone who had that perfect performance. Are you getting information from the athlete, from that pitcher on the debrief afterwards, in order to garner, to maybe share with other clients or to share with him?
Absolutely. Good. Got it. Absolutely. Well, that's right. And often it looks like this. Let's say I'm working with a starting pitcher or a reliever, and they've had about 3 or 4 consecutive outings that have not gone well. But their teammate, has an ERA of, 1.42, which is very low in their last, 35 innings of work. That's where I might, help the pitcher who's struggling a little bit and is sort of not self-correcting. Their performance is sliding and not in a good way. In my consultation with the pitcher who recently has been struggling, I'll pull some things from another pitcher that I've worked, let's say, who threw a no-hitter, but to connect some dots and say, what you see out there with, let's call him Jason, who just threw a no-hitter. Let's say it's Andrew who's struggling and Jason who is really lighting it up out there. I'll tell Andrew, okay, what you see out there from Jason is the nice smooth wind up and the delivery and his arm angle and his arm slot and the late movement on his pitches and keeping the ball down and getting ahead of the count. That's all seen. But the mental game you cannot see, but it's fueling that performance. It's allowing Jason's talent and ability that he's worked hard to train up with coaches and people and physical skills. It's allowing them to perform at their best out there. And so then Andrew has a greater level of insight and awareness of precisely what you can't see, but is helping Jason to be really successful, in his last 5 times out there on the mound. And what you find is that with Jason, he's performing out there, with confidence and trust and focus, and he's not trying to throw strikes. He's not trying to get ahead of the hitters. He's not trying to get ground balls. He's not trying to get strikes and outs in innings. In fact, when Jason is performing out there, he's so confident and so trusting. He would report to Andrew. He'd say, Andrew, when I'm out there and lighting it up out there, he's like, honestly, it's like I'm not even trying out there.
So I have one last question regarding
Yeah. So that's where maybe with Andrew, who's struggling, he's trying to get results. And that is often very, very problematic, because when an athlete is going really well and in the zone and performing really high out there, they will tell you person for person, it's like I'm not even trying out there, because they don't have to try really hard. This is what they do. It's about confidence and trust and knowing who you are, and that allows you to attack the strike zone with your best stuff, and it's a totally different feel.
So I have one more performance question, then I want to get back to the pain and the injury side of this. Is there any benefit? It sounds like you do a lot of one-on-one, but is there any benefit? A lot of these, baseball is, it's a team sport, but it's not a team sport. Golf is an individual sport, but is there any benefit to you speaking to a team as a whole, as opposed to just each individual player?
Yes, and that's also what sometimes they're doing, works with individual athletes when I was the pitchers, but also as I would work with the Orioles minor league teams, I would work with the pitching staff. Excuse me, the pitching staff as a group. I would say more impactful is working one-on-one, because then I can do a needs assessment and I can tailor fit a mental and emotional skill development plan for that athlete. You're talking a little bit more generalization when you're talking about, talking to the group, and soldiering, or the unit, rather than, one-on-one with the individual soldier, or sort of the team. You can do some really good work. You can have a group discussion about some things that are going well and some things that are not going as well, and so some commonalities, on both sides of performance, and you can provide, instruction and even give them some tools to apply. But the one-on-one is where you can really be, far more, specific. Also, sometimes, Andrew, in a group setting, in a team, not everything is discussed in a group format. Whereas sometimes you get them individually, and in terms of self-disclosure, they'll say, okay, here's what's really is going on. It could be something off the field that's affecting on the field, but that person might not feel comfortable expressing that in a group, even though you might within a team consultation, you might ask them a specific question, what's not working for you, but there might be some vulnerability there. There might be concern about others' perceptions of what they communicate to me. And there's lots of things that go on there. Or if a coach is sitting in on the group discussion.
I was more referring to, training. So you have a youth team who needs to learn mental imagery of being able to visualize the game, or when you're sitting on the sidelines waiting to get in, to help them imagine what you would do in this situation, or where your head should be at while you're sitting on the bench waiting to get your turn to enter the game. That's where I guess my question wasn't specific enough.
Yeah, no, absolutely. And that's when sometimes you do individual work and sometimes you do teamwork. Sometimes I'll have a team that will bring me in for, a 60-minute or a 90-minute presentation for the team. And that can be very, very valuable. They're going to receive education, some tools, some techniques to apply. You mentioned visualization. And that's certainly a performance psychology tool that lots of competitive athletes use. And the idea is you're sort of simulating the action and you're executing this task in your mind before it even happens. So it's almost like when you're actually, in sport, it feels like it's the second time you're doing it because you just lit this up in your mind before it even happens. And it's good visualization is good mental preparation, and it's confidence building. And it's all things that help you to get into that peak performance zone that you mentioned. And of course, all of that can be done in more of a collective group in environment. Once you get to the individual, you might talk about their own pre-performance routine on an individual level, and when and how are we going to integrate some imagery and visualization as part of your mental prep and part of your routine. That's when it becomes very specific to the individual athlete. But lots of things can be done in a team environment. And oftentimes my entry in to working with an individual is first in a team format. So I'll do a group discussion or a classroom discussion so that they get a taste of what some of this stuff is. And then if they want some more personalized instruction, then often the one-on-one follows once they get the group presentation where they say, oh, this is really good stuff. These are my specific pain points, my specific issues and challenges. Can we work one-on-one so you can tailor fit something for me that addresses wants and needs and that type of thing?
So you work for the Orioles. I used to be an Orioles fan, and somehow I think it's the Washington Post stopped writing as much about the Orioles when I used to read the newspaper and transitioned to become a Nats fan. And I had a former minor league / major league baseball player, Connor Mully, on, and we asked him a question about Steven Strasburg. So I've got coaches coming on and I've got surgeons coming on, and I want to kind of ask you, if you were in the Nationals organization and you just made the playoffs and you've got a pitcher like Steven Strasburg, who has made a fantastic recovery from Tommy John surgery, there's got to be two discussions going on. The coach or the manager or the general manager have to be speaking to you with regards to, hey, we're thinking about shutting Steven down for the playoffs. How is this going to affect his future performance now that he's got the confidence back? As well as you have to go and speak to Steven Strasburg as well to say, hey, where's your head at with this decision of them shutting you down for your protection or what? Right. So how would you, you were on both, if you were in that scenario, how would you approach, come up with that, being involved in that conversation with management as well as being in that conversation with the player?
Yeah. And right. You have your commitment to the team. You also have, first of all, I would only be working with Steven Strasburg if Steven Strasburg wanted to work with me based on the MLB player, the MLB PA. This
is a hypothetical. We're talking hypothetical here because we're in Nats country here.
So let's say I am working with Strasburg, and he's one of my guys that I'm working with. But then again, I have my, the guy who signs my paychecks are, the GM and VP of baseball operations. So
now we're talking business here.
Yeah. So you have to straddle those two things: your commitment to the organization, and so that we're sort of on the same page, but on an individual athlete level as well. And with experience, you strike that effective balance. But what you were talking about specifically is, if I'm working with Strasburg in that situation that you just laid out. Yeah, I want to get to know, what are your thoughts and perceptions, about this, or let's say, and how can we perceive this situation? And let's say if he's having a lot of difficulty with it, it might be based on how he's interpreting the situation, how he's perceiving it, what he's saying to himself. And so in my consultation, with Strasburg, it would be, how do we make sense of this? How do we perceive this in a more constructive way so that it works for me, rather than having me, feel a certain way based on a perception or an interpretation. He might be looking at this through a very narrow focal lens. he might be seeing this in a way that does not serve him well. But if we see this situation in a more adaptive and effective way, your whole relationship with the environment, with the situation might be a little bit better. More common to the work that I did was, let's say I was working with a pitcher at AAA, and we're doing some great work. And in the last 5 outings, he's just dominating at the AAA level. And then somebody is just underperforming on the big league team or got injured, and then the phone call comes and you get called up to the big leagues. And then let's say, for whatever reason, it could be just a numbers game in roster spots, or let's say they didn't pitch well, and that's a big jump from AAA to the big leagues. Let's say that they get sent back down to the minor leagues. And let's say it happens many times. Often you yo-yo between AAA and the big league team. Well, it's not an issue when you get called up to the big leagues. That phone call is always well received. But lots of times you will have a pitcher who, let's say, gets sent back down to the minors. Sometimes you get sent to AA to do a rehab assignment, or sometimes you get back to AAA, but you are being sent back down to the minors. The athlete's perception of that experience has everything to do with their mental state and everything to do with performance. We have to be able to interpret this and perceive this in a more adaptive way, constructive way, powerful way, so that you can continue. And so you can put yourself in a position, hopefully, to get back there. There are some people who are just destroyed by it. There's some players who get, once they get sent down to the minors, they never make it back. And it has a lot to do with their sort of cognitive perceptual skills and how they're perceiving this. Whereas another player who might sent down sees this in a totally different light. And I help to facilitate that.
So you brought up an interesting point about back again in this common theme that it's a business and who's paying your paycheck. And now I can kind of see with some athletes, some high level athletes, where there's a lack of trust to an extent, who's got your best interests at heart. If you're working for the team, where you have a guy like Tom Brady, who's got his own team, his own trainers, his own doctors, why a lot of players will often seek outside help, outside sports psychologists, outside of the team, because they want to have, all right, this is what the team is saying, but is this, what's best for Steven? And thank you for your perspective. I didn't even think about from that aspect of, from pro sports, where your obligation is to the guy paying your paycheck to an extent, but you're also obligated to that player, because that player is the franchise, so we want to make sure that, whatever we're doing, that we're not setting him back. We're putting him in a position to succeed. And, the history has shown itself that Strasburg was, I think, the MVP of the World Series a couple of years later, and was just, one of the most dominant pitchers to ever play. So anyways, transitioning back to my realm of injury and pain management and dealing with acute and chronic pain, and pain medication, some of the things I want to talk about. But one of the things I want to ask about you is, with an athlete trying to understand the psychology of, as they're returning to the field, what's the difference of being hurt and being injured? How do you help an athlete with that returning to the field? This feels awkward, or this doesn't feel normal, or just an athlete who's banged up and can continue to play versus, when to take themselves out of the game.
That's a good question. And it's not easily answered, because it requires a high level of awareness of the individual athlete. Is this something that I can just push through, or is this sort of the severity of it to the extent where I'm not doing myself or the team any benefit by being out here? And sometimes communicating that to coach that you're hurt and to take out is often difficult. It might have to do with other people's perceptions, teammates of doing something like that, where the other person is pushing through the pain. So it's not the easiest thing to to do. I suppose if I'm talking to the athlete, we find what that line, what that line is, because you have to sort of know where that line is, because what you don't want to do is, if you're hurt, is to put more stress the body more, and that's when you can have a real injury. Now you can find yourself out of action for for a while. The bigger issue, though, is and we're talking about injury transitions, is when the athlete sort of post-injury or post-surgery does get the medical clearance, that they get the green light that you have done all the rehab protocols, you are, and let's say you're actually pain-free, and you did the rehab and the recovery, and you worked with your OTs and your PTs and your surgeon, and now you are at a place in mind and body and physically, you get the green light, you're ready to go back in. But as I mentioned when we started this talk about injury transitions, the hardest part is the psychological transition. I'm going to give you an example. Let's say that now you're the athlete now, and you're sort of inside your head, and you have something called kinesiophobia, which is
in my mind. That's where I was going. Yeah.
Okay, right. So let's say, which is kind of a fear of moving your body in a certain way. Now, remember, this athlete got injured out there, and maybe it was a surgical fix, or maybe just doing your working with a physical therapist and getting healthy. So let's say you've gotten the green light. You've done the rehab and recovery, working with a performance team. But let's say on the mental side, you have this kinesiophobia, and you have this fear of moving your body in a certain way. The behavior that's associated with that psychological fear, that cognitive fear, is something called guarding. And it's you moving your body in a certain way to guard against re-injury. So it starts with a fear that this fear that if I move my body in a certain way, I might, it might not serve me very well. And then you guard against re-injury. And when you guard, now you're moving your body in a certain way. There could be a weight imbalance, right? And you're trying to prevent pain. You're trying to prevent something bad from happening, getting re-injured. And that's precisely when you see a lot of athletes get re-injured. They get re-injured because they're guarding against re-injury. And the guarding, the moving your body in a certain way, is based on the cognitive fear. This is just an example of how that psychological transition back into sport can be very difficult. Because they got medical clearance, you're good to go. But that doesn't mean they've made the psychological transition. They might have this fear of getting re-injured, and that's the space that I work with a lot of athletes once they have gotten medical clearance, helping them to make the successful transition back into sport so that they perform well and don't get injured, and don't get injured again. And my guess is you sometimes will work with some athletes who have done the rehab and recovery, but they get re-injured. And there's lots of ways you can get re-injured, right? There can be a straight physical thing, there's lots of, but there is a psychological dimension to having repeated injuries, because when you start guarding, there's muscle tension, there's tightness, there's weight imbalance. Now you're on this side of your body because you're guarding, because if you move on this side, well, that's the side that you initially got hurt on and put you, on the disabled list or led to the ACL surgery. So it's really important to go through some of these things. And again, things like kinesiophobia and psychological fear and guarding, that's something that's in the sports psychology wheelhouse. So that's why someone like me and someone like you, I love working with other members of the performance team, because it's separate, but it's interrelated, all for the benefit of the athlete to consistently perform at their best, but also to make successful injury transitions. You need the primary care surgeon, and a good one. You need the OTs and the PTs. Sometimes the sport, sometimes a team will hire the massage therapist before they'll hire me, but I can tell you it's really changing. And mental conditioning, sports psychology, performance psychology is really coming to the forefront.